My name is Ilana Ackerman from Monash University, and I'm delighted to introduce our new report, Time to Act, the current and future burden of arthritis, long-term back problems and osteoporosis in Western Australia. The report was built in partnership with Curtin University and Arthritis and Osteoporosis Western Australia. I would like to acknowledge the contributions of our project team and those who've reviewed and provided valuable input into the report. Thinking about the potential impact of common musculoskeletal conditions in the years ahead helps us in many ways. It helps us raise awareness in the community about how common these conditions are and to advocate for better education and support. It provides critical information to help plan for what healthcare services might be needed and how these services can be funded. It also helps plan for the health professional workforce that will be needed to provide high-quality care for people living with common musculoskeletal conditions. And it also highlights opportunities for disease prevention, care and research. While this report provides disease estimates for Western Australia, it's important for us to acknowledge that behind the numbers are individuals, families and communities. In preparing this report, our hope is that the numbers will be used to plan services and supports to improve quality of life and enable West Australians to live well with musculoskeletal conditions. For this report, we used available data from the Australian Institute of Health and Welfare and the Australian Bureau of Statistics. We used data on how common the different conditions are and the amount of spending by the health system. We also use data on how the population of Western Australia is expected to grow in the years ahead, based on different assumptions around births, deaths, and migration. We started with a base case analysis, which assumed median population growth for Western Australia. First, we forecast the likely number of people living with each condition for the years 2025 to 2045, and we produced estimates for females and males for different age groups and overall. We then looked at different scenarios based on low or high population growth. Next, we forecast the likely cost to the health system for the years 2025 to 2045, and we also sought input from stakeholders, including consumers with lived experience. We estimate that by 2045 there will be over 600,000 West Australians living with arthritis. That's a 41% increase from 2025 numbers, or an additional 177,000 people, based on population growth and ageing. And looking at this graph, we can see that the highest burden is among people aged 65 years and over. We estimate that by 2045 there will be over 597,000 West Australians living with long-term back problems, defined as conditions lasting at least 6 months. This is a 29% increase from 2025 numbers, and we anticipate a similar burden for males and females. We estimate that by 2045 there will be over 152,000 West Australians living with osteoporosis, including osteopenia. This represents a 51% increase from 2025 numbers with population growth and ageing, and our estimates show a much higher burden among females than males. In terms of health system spending, we have forecast that spending for osteoarthritis could grow from $486 million in 2025 to over $1.1 billion in 2045, when we consider the number of West Australians likely to be living with the condition. For rheumatoid arthritis, we forecast that health system spending could increase from $116 million to $265 million. And for long-term back problems, we have forecast that spending could increase from $426 million to $874 million. In total, health system spending for these three conditions is forecast to be more than $2.25 billion in 2045. These projections indicate an enormous anticipated burden of common musculoskeletal conditions in Western Australia over the next 2 decades. The estimates highlight that females are most affected by arthritis and osteoporosis, and that the highest prevalence is among older individuals. Ultimately, these projections underscore the critical need for timely access to care and greater investment in prevention, high-value care, and research. For more information, please go to the Arthritis and Osteoporosis Western Australia website, where you can download a copy of the full report.